Fibroids are a leading cause of infertility in most women of reproductive age worldwide. Today we are going to look at fibroids. How are they affecting your fertility, their causes, their signs and symptoms, and how we can treat them. Welcome to the fertility series. I am Dr. Raisha, a pharmacist and a fertility and women's health expert. If you are new to this channel, please do not forget to subscribe and hit the notification bell down below. So, today we are going to look at uterine fibroids. I want you to pay keen attention to my diagram here. Do not worry how it looks like. The most important thing is you get the point that I'm trying to put across. So, what is fibroids? Fibroids are benign tumors. We call them masses, growths, or tumors. When I say something is benign, I mean something is not cancerous, because most fibroids are not cancerous. So they are benign tumors growing in the endometrial wall, in the uterine wall. So this is the ovary, this is the uterus, and this is the uterine wall. And this here is the uterus. This is the ovary. This here is the cervix. Here we have the vagina. So we have different types of fibroids. What you can see here, these shaded things are fibroids. But fibroids have different sizes, they have different types, and they are in different locations. So look here, we have this fibroid that is hanging here. We call this a pedunculated fibroid. This one that is in between the mucosal, we call it a submucosal. This one that is at the edge of the uterine wall, we call this a subserosal. And these small fibroids in between the uterine wall, we call this intramural. And so those are the different types of fibroids that we have. And so what causes fibroids? It is sad to say that the cause of fibroids is not known. But we have some hormones that we relate to fibroids. But before I go to that, I want you to know that a fibroid can grow up to 15 centimeters or above. So if you look at that 30 centimeter ruler that you have at home, and you go and look at the 15 centimeters mark, so you can imagine something that big. So yes, a fibroid can grow up to that, and most of them are usually firm. They occur in multiples. Most of the time when a woman has fibroids, they do not have just one. They have multiple fibroids, and most of the time they are spherical in shape. And so, as I mentioned earlier, we have some hormones that are known to cause the growth of fibroids, and these are hormones such as estrogen. You find here in the uterine wall, this is a fibroid and this is the normal uterine tissue. You find that the fibroid has many estrogen receptors in higher concentration than the surrounding uterine wall. And so estrogen is known to increase the growth of a fibroid. It is known to increase the size of a fibroid. A fibroid increases in size during pregnancy because there is high levels of estrogen in the body. Again, it also increases in size when this woman is exposed to estrogen, maybe due to the contraceptives that she is taking. We also find that now when a woman reaches menopause, the levels of estrogen in her body decreases, and hence now the fibroids start decreasing in size. Again, before puberty, the fibroids are usually undetectable. Another hormone, progesterone. Progesterone is known to increase the growth of the cells in our fibroids and decrease their death. It increases their growth and decreases their death. So they grow more and die less. And this leads to increase in the size of our fibroids. Another thing is genetics. This is whereby you find if your mother, a first degree relative of yours, has fibroids, you are at higher risk of getting fibroids. And so, what are some of the signs and symptoms that women with uterine fibroids experience? Number one, they experience pain. And why do they experience pain? I want you to look here. So, when a woman has a fibroid, the uterine notices that there is something foreign. And so it contracts, trying to expel this myoma. A fibroid is also known as a leiomyoma or a myoma. So the uterine is contracting, trying to expel the fibroid, and this could lead to a lot of pain. Again, this pedunculated fibroid here, it is just hanging. Okay, and so in the process, it could toss like this. It could turn and toss, something we call torsion of the fibroid, and this could lead to severe pain. Another thing that could be causing the pain is, look at this fibroid here. So in between here, of course, we have blood vessels. Okay, and so it is congesting, it is pressing onto those blood vessels, and so interrupting the blood supply. And so when it is congesting on the blood vessels, the blood supply is interrupted, and that could lead to death, something we call necrosis of the tissues that are surrounding there. And also this could lead to infections. Again, look at our cervical. We have one that could be here on the cervix that we call a cervical myoma. And so this cervical myoma could lead to pain during sexual intercourse. Another sign that this woman could be experiencing is abnormal uterine bleeding, whereby you could find that this woman could be bleeding in between her periods, what we call intermenstrual bleeding, or very heavy bleeding, what we call menorrhagia. But also this depends on the type of fibroid. You see, mostly if this woman has a pedunculated fibroid, this causes intermenstrual bleeding. Okay, but if a woman has a submucous like this, she could also be experiencing menorrhagia. She could be experiencing premenstrual and postmenstrual spotting, whereby she finds that maybe that she has spotting. Okay, and so this submucous fibroid that is here, number one, it is congesting on the blood vessels. Okay, it is also interrupting with the blood supply to these regions. And again, it could also cause ulceration, okay, whereby now this endometrial lining here now develops ulcers. And all these are contributing to the abnormal uterine bleeding. Another sign that these women may experience is spontaneous abortion. This is whereby you find the woman miscarrying every time. Another sign is pressure effect. What do I mean by pressure effects? All right, so this fibroid is there. It is there. In the pelvic region, we have other organs such as the rectum. We have organs such as the bladder, and it is pressing against the bladder. It is pressing against the rectum. It is pressing against other rectum. So if it is pressing against the bladder, that is what we call pressure. It is putting pressure on the bladder. And so you could find this person as having urinary symptoms, whereby you feel like going to urinate every single time. Another thing, it could also be pressing against the bowel. It could be pressing against the rectum, and this could cause what we call tenesmus. And it could also cause what we call constipation. Another thing is infertility. These fibroids are also associated with infertility because now, due to that spontaneous abortions, this woman is unable to conceive. But I do not mean that a woman with fibroids do not conceive. Some actually conceive, but most of them who have fibroids have been known not to conceive until when the fibroid is removed. That is when you find them conceiving. And so I want you also to note that the signs and symptoms depend with also the size of the fibroid. We said that this fibroid could grow up to 15 centimeters or longer. When somebody has a fibroid 15 centimeters, can that uterus harbor a baby? No, because it will be competing with the baby, you see, for space. So the signs and symptoms depend with the size, they depend with the location, and also the pregnancy status of this woman. Is this woman pregnant or is this woman not pregnant? And we are going to look at some of the complications that women who are pregnant get when they have fibroids, and women who are not pregnant get when they have fibroids. Before we treat, we always say that the doctor has to do some investigations. The doctor will not just look at your signs and say you have a fibroid. No, they have to investigate. Now, this is where they carry out things such as an ultrasound scan or an MRI scan. And so, before treating, let us look at some of the complications that women with fibroids could get. We've said that yes, it is possible for you to get pregnant with a fibroid. And so, but when a woman is pregnant, we also said that the fibroids increase in size. So you will find that a fibroid that was this size now becomes this size and is increasing in size as time goes by. And so now this means that this fibroid, they have blood supply to the fibroids. But now this one is bigger, so it needs more blood. And so blood supply to the fibroid could not be enough. It could be depleted. And so now the fibroid will start degenerating, something we call red degeneration. And this leads to a lot of pain. Another thing, this woman could be unable to carry this baby to term and have what we call preterm labor. But they could also carry this baby to term, but during labor, they could experience some things such as obstruction of the birth canal. Maybe it is a cervical like this, so it is obstructing the birth canal. So now the baby cannot come out. You cannot push the baby out. And so we say that when a woman has a cervical myoma like this, mostly they have to do CS. That is the cesarean section. Another thing is postpartum hemorrhage. Now, after this woman has given birth, they could have what we call postpartum hemorrhage. That is bleeding after giving birth. Also, what about now a woman who is not pregnant? A woman who is not pregnant, we've talked about things such as abnormal uterine bleeding, and this could lead to lack of blood, iron deficiency, and so this woman could get anemia. Another thing is malignant transformation. This is whereby now the fibroid now becomes cancerous. And another thing is bowel obstruction or intestinal obstruction. We have talked about now the fibroids pressing on the rectum, pressing on the bowel, pressing on the bladder. And so it could lead to bowel obstruction. And this could lead to constipation. This could mean now this woman is not able to go to the toilet because now it is obstructed. So all the contents in the intestines cannot pass. I want you to note, now, when we are treating fibroids, the treatment will depend on a number of things. They will depend, number one, on the location of this fibroid. They will depend, number two, on the size. How big is it? They will also depend on the pregnancy status of this woman. Is this woman pregnant or not? They will also depend on the desire to get pregnant. Do you wish to get pregnant in future or not? They will also depend on the number of children that you've had. They will also depend on the signs and symptoms that you are experiencing. Why do I say that? So let us look at treatment of fibroids. If a woman is asymptomatic, maybe you are not experiencing any signs. You do not have any signs, you do not have any symptoms. But maybe you went for your routine checkup and they saw fibroids. That one we do not treat because it is asymptomatic. But they just put you on follow-up so that they can be following you up maybe after every 4 to 6 months. We do not treat. If a woman is postmenopausal, that's why we were saying it also depends on the age. If a woman is postmenopausal, we do not treat because most of the times they are asymptomatic. Okay, but now if it is symptomatic, then this calls for most probably we have to remove it. Now, this is where surgery comes in. So now we could do surgery on this person, but we have different types of surgery. The doctors have to ask you, do you wish to get pregnant? Do you wish to get pregnant in the future? And so if it is a woman who wishes to get pregnant, we do something we call myomectomy. Myomectomy is whereby they just remove the fibroid, and this preserves your fertility. But maybe this woman does not even wish to get pregnant. So they will do something we call total abdominal myomectomy. So this is whereby now they remove the entire uterus now. All the uterus is taken out. And so now this woman cannot conceive. Now this one does not preserve fertility. Again, we say that most of the times when women are pregnant, maybe somebody could ask me, yes, now this woman is pregnant. We do not do myomectomy in pregnant women. And it is not advised maybe when this woman now is taken to CS, so you take out the baby and the fibroid. No. It is not advised to take out maybe the fibroids during CS, but a myomectomy cannot be done in a woman who is pregnant. You wait for that woman maybe to carry the baby to term, or maybe if she miscarriages now, you could take out the fibroid, preparing her for the next pregnancy. And that is it about fibroids. I hope you've understood what fibroids are, their signs and symptoms, and how we can treat them. If you like this video, guys, please do not forget to give it a thumbs up. And if you have not subscribed, please do not forget to subscribe.